Good morning, friends. Today's recall questions are 2 weeks after URTI, a child had a hematuria. No symptoms were mentioned. Probable cause of hematuria. So, 2 weeks after upper respiratory tract infection, child developed hematuria. In option, they have given the IgA nephropathy, and there are no other option mentioned. So what could be the cause of 2 weeks after upper respiratory tract infection? As IgA nephropathy is not the correct answer because IgA nephropathy develops within 1 week after upper respiratory tract infection. But here, this is 2 weeks after upper respiratory tract infection. After 2 weeks of upper respiratory tract infection, the cause could be post-streptococcal glomerular nephritis, which present after 2 weeks of upper respiratory tract infection. Child can develop hematuria 2 weeks after upper respiratory tract infection. There are other options can be there like Hinosh HSP, colon purpura, which can present with the hematuria, but purpuric rash and joint pains, abdominal pain, these symptoms would be there. But here they have mentioned only hematuria, and child has developed 2 weeks after upper respiratory tract infection. So the correct answer would be post-streptococcal glomerular nephritis. Our next question is an old lady complain of lower back pain. There was something mentioned about osteoporosis and was given some medications, I think paracetamol plus antibiotics. After that, she had hematuria. What could be the mostly the cause of hematuria? So here asking the cause of hematuria, an old lady presented with lower back pain, and they have mentioned that osteoporosis was there, and she was given some medication which is paracetamol plus antibiotics. So now asking the cause of hematuria as number one cause, they have given the UTI. Another is interaction of medication. Third one is renal disease or renal problem. So this old lady presented with lower back pain with hematuria, and she developed hematuria after when she was given some medicines, which is paracetamol and antibiotics. So now we have to rule out that what could be the mostly the cause of hematuria. As we can see here in the option, they have given the renal disease and our renal problem. So first we'll think that what could be the renal disease can be there, like if patient has taken medicines like maybe antibiotics or any NSAIDs that can develop the acute interstitial nephritis. This acute interstitial nephritis, which develops 7 to 14 days after taking drugs. Here they have mentioned paracetamol. Normally, paracetamol is safe. This might be some other NSAIDs they can mention in this question, and as they have mentioned the antibiotics, so these drugs can cause the acute interstitial nephritis. But an acute interstitial nephritis will be developed after within a 7 to 14 days, and there will be some other symptoms like high eosinophils, raised creatinine level, fever, rash, these symptoms will be there. What other causes can cause this hematuria, like kidney stones? But in the kidney stones, there will be sharp pain, hematuria. That would be a gross hematuria. Visible blood will be there. And some other causes, other renal cancers or renal kidney carcinoma, these are bladders, see a bladder also can cause this hematuria, as they have mentioned the renal disease and these problems. But these, there will be some other symptoms apart from this hematuria. So this renal disease and renal problem is not the correct answer. Next option, they have given the interaction of medication. So as they have mentioned the medicines, if paracetamol and antibiotics, there is a no interaction between these two, which can cause the hematuria. So that interaction of medication is also not the correct answer. So whenever the old lady presented with the lower back pain, and after this she developed the hematuria, so the correct answer would be the UTI. So UTI is very commonly occurs in the old lady patients. So this possibility of this answer is the UTI. The hematuria, the cause of as she developed the hematuria after this lower back pain. So the cause could be the urinary tract infection. I hope this question, this answer will be helpful for you. Thank you very much.